Video shows couple passed out after snorting heroin. A disturbing video showing drug users unconscious on a Memphis sidewalk has gone viral, showcasing the dangers of drug addiction in an apathetic society. Cortland Garner was driving when he saw a man and a woman passed out by the street. He got out and immediately began streaming the scene on Facebook Live. The man was lying on his back, fully unconscious, while the woman had her face to the ground. Both had snorted heroin at a nearby Walgreens. Garner made no move to help and can be heard laughing behind the camera. He later claimed someone had already called 911. The couple were revived by cops and taken to the hospital. More videos of people overdosing in public are popping up, likely due to the growing opiate epidemic in the U.S.
This is Dr. Kane. I'm a cardiology fellow at UMS, and as you've seen, opiate abuse can be devastating. Opiate abuse is very, very widespread, and this relates to both prescribed opiate use and abuse, as well as non-prescribed opiate abuse. According to the National Institute of Health, the number of opiate prescriptions continues to increase annually. In 2013, there were 207 million prescriptions written for opiates at that time. Now, opiate abuse usually starts very innocently. Usually there's some event, some back pain, motor vehicle accident, which requires that opiates be prescribed. And it may be very innocent, but oftentimes people become dependent. And this opiate dependence, there is no prejudice by race or socioeconomic status. Prolonged opiate use will eventually lead to dependence. Now, you've seen in the videos probably the extreme end of opiate use, the devastating part of opiate abuse resulting in death. But there are other consequences, financial, problems with relationships, and often these patients, they spend a lot of time seeking opiates, either through physicians, through local ERs, or elsewhere on the streets. Additionally, they have effects on mood, on cognition and judgment, and may affect the way you interact with friends and family. Now, in terms of opiates use and abuse, most often these patients, they do have genuine heart problems as well as other health problems. And typically, these patients are much more difficult to manage. Usually, inpatient admissions result in interruption of their habits, and overall, symptoms of withdrawal. These patients become much more challenging to manage, and overall, it's harder to give them care, resulting in higher cost of care. There are a lot of long-term effects also of opiate abuse, mainly cognitive, as well as specific problems related to the heart. Often we'll see patients come in with endarteritis, or even worse, endocarditis. And this really refers to when the heart valve becomes infected due to bacteria that may be introduced during the time of injection of injectable opiates. This is a very difficult condition to treat. Again, it can be devastating. It usually may not result in immediate death, but a life long of congestive heart failure, stroke symptoms, and can be devastating in its own way. Oftentimes it may require heart surgery and the placement of artificial valve. And unless patients deviate from this pattern of abuse, this may become a recurring problem where mechanical valves then become infected, and so on and so on. So overall, opiate abuse may have cardiovascular specific problems as well as general health problems. Finally, I'll say this. Very often these patients, especially patients who are prescribed opiates, when they lose access to healthcare, opiates may then become a bridgeway for other harder and even more devastating drugs.
I am Dr. Nairuz from UAMS. Opioid abuse is an epidemic affecting millions of lives around this country with major social, health, and economic repercussions. It is important to understand the magnitude of this as an epidemic affecting our economy. For example, in 2013, the total economic burden was estimated to be 78.5 billion US dollars. Over one-third of this amount was due to increased healthcare and substance abuse treatment costs. Approximately one-quarter of this cost was borne by the public sector in healthcare, substance abuse treatment, and criminal justice costs. I hope the following presentation by our students in public health serves as an eye-opener regarding the magnitude of this problem. Thank you.
Multi-dimensional analysis of opioid addiction. For our group project, we wanted to address the opioid epidemic in the United States. Opioid use and addiction affects millions of people every year. CDC Director Dr. Tom Frieden stated, "More than 40 Americans die each day from overdoses involving prescription opioids. Families and communities continue to be devastated by the epidemic of prescription opioid overdoses. The rising cost of the epidemic is also a tremendous burden for the healthcare system." Abuse of opioids is a serious global problem that affects the health, social, and economic welfare of all societies. In fact, it is estimated that between 26.4 million and 36 million people abuse opioids worldwide. That equated to about 0.5% of the world's population. The U.S. has seen a huge increase in addiction to prescription opiates and heroin in recent years. With an increase in opiate addiction comes an increase in opiate-related deaths. The CDC estimated that 44 people died every day from the painkiller overdoses in the U.S. The U.S. has always been among the top 10 countries in the world using opioids, but it was not the leader until more recent years. In the past 30 or so years, the U.S. has been the leading global consumer of opioids. Since 1980, the usage of morphine has decreased, while the much stronger synthetic opioid oxycodone has become more popular. You may hear oxycodone referred to as Oxycontin, Roxicodone, and Percocet, which are all brand name formulations of oxycodone. Now we are going to show you figures from opioid use in the U.S. over time. The chart on the left describes opioid consumption in kilograms for the year reported. The chart compares 6 different countries. The chart on the right describes opioid consumption in milligrams per capita. This chart compares 10 different countries. In both charts, the light blue represents methadone, the dark blue represents morphine, and the green represents oxycodone. The U.S. is circled in purple in each of the charts for easy comparison. Now we have moved forward 10 years to 1990. I want to point out that while the chart on the left looks similar to the slide before, the scale has almost doubled, indicating a very large increase in opioid use. In 1990, the U.S. was the leading consumer of methadone, morphine, and oxycodone in weight of opioids. The morphine use has increased significantly over the past 10 years. Morphine was a little over 3,000 kilograms, oxycodone was a little below 2,500 kilograms, and methadone was right under 2,000 kilograms. On the right, you can see that the U.S. was still not the leader in per capita consumptions for morphine or methadone. The U.S. was the leading consumer of oxycodone. Once again, we've moved forward 10 years, from 1990 to 2000. Opioid use skyrocketed in the U.S. Oxycodone use was around 17,500 kilograms, or around 60 milligrams per capita. This far outweighed all the other countries in both charts. Per capita, the U.S. was still not the leading consumer of methadone and morphine, but total kilograms consumed far outweighed the other countries. The U.S. consumed around 8,000 kilograms of morphine and a little over 5,000 kilograms of methadone in 2000. These numbers are staggering. Skip forward another 10 years, and we are looking at the point where we become the leading consumers of methadone, morphine, and oxycodone, both per weight and a milligram per capita scale. In 2010, 59,000 kilograms of oxycodone was consumed. That is the equivalent mass of about 10 large elephants. And the U.S. also consumed 23,000 kilograms of morphine and 15,000 kilograms of methadone. The most recent data is from 2014, just 2 years ago. In 2014, the U.S. consumed around 63,000 kilograms of oxycodone. The U.S. used 2,000 kilograms more oxycodone in 2014 than 2010. The morphine and methadone consumption per kilogram stayed about the same. The chart on the right shows that the U.S. was the leading consumer of oxycodone in milligram per capita among the 10 countries that were compared. The U.S. was second in methadone consumption per capita behind Canada. The U.S. was third behind in the consumption of morphine per capita behind Canada and Denmark. This slide really speaks to how prevalent opioid usage is in the United States. In 15 years, from 1999 to 2014, more than 165,000 Americans died from prescription opioid overdoses. This is an average of 11,000 deaths per year during the time span. This figure is only for prescription opioids, not counting other illegal synthetic opioids and heroin. In more recent years, the death toll has been on the rise. This can be somewhat attributed to the increase in much stronger synthetic opioids entering the illegal drug ring and the increasing prevalence of heroin. The financial toll of opioid abuse includes direct healthcare costs, lost productivity, and costs to the criminal justice system. Nearly 25% of the economic burden was shouldered by public sources, such as taxes. Using the most associated with opioids on the previous slide, an estimated $19.6 billion a year are paid from the pockets of the public. Here is yet another example of how the opioid epidemic affects everyone in the U.S., not just the addict and their families. $7.7 billion are spent on criminal justice-related costs every year. There was also a decrease in tax revenue from the opioid users due to a loss of productivity. In 2013, 16,000 people died of opioid overdoses. Fatal overdoses cost the economy $21.5 million. Costs associated with opioid usage in Arkansas for 2011 was $205,529,321. Recent studies have found that opioids are considered easy to get. 55% of people stated they obtained it free from a friend or relative, while 11.4% said they bought the opioid from a friend or relative. Only 17.3% of opioids users were prescribed the opioid by a doctor. Religiosity refers to a person's behavior and attitudinal religious fervor, regardless of the content of his or her beliefs. It varies from individual to individual. "95% of Americans have some religious faith. Religion has been associated with positive drug-related outcomes and protecting adolescents against substance abuse. It may inhibit or reduce risky behaviors. It can also provide opportunities for non-risky social activities and provide interaction with non-deviant peers. Religious involvement can also prove to be a key factor in recovery programs." According to the Center for Public Integrity, 227 million opioid prescriptions were given out in the United States in 2014. As of today, over 165,000 Americans have died from the overuse of opioids, and more than that have debilitating addictions to it. Drug regulations are usually handled federally, but everyday citizens are going to their state capitals and pushing for statewide solutions and restrictions. States such as Washington and Tennessee have presented bills to restrict opioid prescriptions, but a national network of drug companies and pro-opioid nonprofit organizations have been fighting back. When opioids were really scrutinized, pharmaceutical companies hired 1,350 lobbyists and legislative hubs to push against any anti-opioid bills. Pharma's number one issue with regulation is anything impeding or reducing the money they are receiving from painkillers being overprescribed. According to the National Institute on Money and State Politics, opioid manufacturers and their allies have contributed roughly $80 million to state and federal candidates and have spent about $746 million on state and federal lobbying since 2006. Here's the spending breakdown. To state, $109 million. To federal, $716 million. To state federal candidates, 45% to Democrats and 54% to Republicans. It is hard to teach kids and adults that drugs are bad when celebrities, TV shows, music, and movies glamorize substance abuse. While celebrities tragically die of drug overdoses every year, people tend to think of it as an abnormality. That it can't happen to me because I may not party as much as a celebrity, when in fact they are just in as much danger. Other groups of people, some of whom live in poverty, believe that drug use is a way to escape from reality. Drugs are used to help them deal with the hand they were dealt. This process is then passed down through family generations. Another issue that we see in the U.S. is that drug abuse is regarded as bad in several community settings. This makes it really hard for addicts to come forward with their problems and seek help. They don't want to disappoint their families and friends by admitting they are a drug addict, nor do they want to face any legal ramifications associated with drug use. Other issues have to do with social aspects. Some examples are religions and cultures that encourage opiate use for spiritual expression. Another example is in athletes. Athletes are expected to perform at very high levels. When injuries happen, painkillers are offered as a way to improve performance. Unfortunately, this can lead to an addiction. In areas such as New Orleans that have a history of substance abuse, there may be some cultural attitudes that are against sobriety and recovery from drug abuse. It also makes it extremely difficult for those living in that environment to stay sober after recovery. Opiates as a way of self-medicating is also a popular culture. They make a person feel good, more relaxed, and not feel the pain and anxiety associated with everyday life. This is essentially true in people with mental illness such as schizophrenia, PTSD, bipolar disorder, depression, and anxiety. As stated before, the culture that you grow up in forms your beliefs on right and wrong and can help you make hard decisions about drug use. Good morals and non-deviant friends can help deter or discourage opiate use. These are just a couple examples on how culture can encourage recovery. We should all be educated about the causes of substance abuse and addiction. The culture of addiction beliefs needs to change from choice to disease. When we start thinking about addiction as a disease, we become more compassionate toward it and can teach people that it's not shameful to seek help for addiction. We should encourage healthy ways to have fun and express yourself. We should lead by example and serve others in meaningful ways. We should also encourage open communication to help addicts feel comfortable about asking for help. Multiple agencies are working to find a solution to this problem. Most solutions start with education. Recently in Arkansas, the 6th annual Arkansas Prescription Drug Abuse Prevention Summit was held for all professions that are exposed to drug abuse. The focus this year was the opioid epidemic, not only in Arkansas but around the U.S. There are multiple resources for healthcare professionals, from how to prevent addiction through patient education, to recognizing signs and symptoms, to having the hard conversations about addiction with a patient. It takes a team to help these patients and to decrease opioid use in the U.S. To help decrease opiate overdoses, first responders are trained how to use naloxone, an opioid reversal agent. These first responders are taught how to handle an opioid overdose situation, from recognizing the symptoms to how to place the patient to decrease aspirations. They are even taught how to be prepared for a combative patient and to prevent further injury of the patient in this situation. The criminal justice system has recognized that prison is not the answer for drug abusers. They need treatment, programs, and social support to be successful. This is an area that is lacking. It is hard to think of opioids as both safe and effective as well as harmful and addictive. Prevention is key, but public education is a critical factor for prevention. Education programs focus on patients, school-age kids, and the general population. There are two different messages. The first is the prevention is key. There are several programs and sponsors of this message. A big one is Drug Take Back Days. This is a huge push that helps get unused drugs off of the streets. The second message focuses on safety, educating the public on the dangers of opioid use, even if your doctor gave you the prescription. There is a belief that if the doctor gave it to you, it is safe. Another safety point is for the families of opioid users. The families can be trained how to use naloxone in an opioid overdose, just as first responders are trained. In conclusion, opioid use and addiction in the U.S. is a major public health problem. There are a few things that we can do to help address the problem. We can educate the public on the safety and concerns of opioids. The key is prevention. Put in place programs to help encourage the preventing of drug abuse. These programs can include children programs to keep them out of trouble, to adult programs to support the addict through their recovery. The biggest change is changing the cultural beliefs of addiction. Most people still believe addiction is a choice. Changing that belief to be accepted as a disease will make it easier for addicts to seek help. The biggest barrier right now in the U.S. is the lack of drug recovery programs. A campaign to increase drug recovery programs and insurance coverage of drug recovery programs would make them more accessible to the population.